Hello, my name is Sarah Bird-Martelli, and I'm the OCAMPR secretary, and I have the great privilege of introducing my friends, Dr. Mena and also Dr. Mena, and to present about liturgical medicine. I've gotten to know both of them, and they are amazing people, amazing Christians, physicians, and just a joy to be around. So I'm sure it will be a great presentation. Thank you.
Welcome, everybody. I'm so excited to be here with Mena, and I don't know if you guys know a lot of Coptic people, but you can walk into any Coptic church and say, Mena, and like 3 people, actually I don't even turn around, I just assume they're not talking to me, because they didn't say like a bad word, or like an insult or something. That's where I'm like, oh, me, no, not this time. Like, oh, okay. But yeah, there's lots of Menas in the Coptic tradition. I invite everybody to come move forward, because I'm a little intimidated by the room. I'm like, first of all, it's too big, and second of all, it's not that full. So for us to have a good workshop and have it be interactive is going to be one of the goals for today. And for the people that are watching the recording, I'm talking to you, Sylvia. They're going to feel like they missed out. And they say, oh, yeah, we'll just look at the recording. Like, no, it's not the same, because you weren't there and you missed out. So we want to keep this like a little bit open and flexible, not to the point where, we're just being like, liturgical medicine. I don't know, like, what do you guys think? And then, we just kind of like we want to do it guided a little bit. We want to make sure that we keep us on track with some goals. But this is going to be the structure where we're going to alternate between sort of sharing a challenge and then discussing together, and then sharing a perspective and then discussing together. I think with a lot of things that OCAMPR does, and I would say Orthodoxy in general does, we're not inventing things, right? We're not saying oh, I came up with this great idea, that's called a heresy. Seriously, that, we think we're so clever, and it's just always just rediscovering things that people have already talked about and wrestled with. And what makes it interesting is not the newness of the idea, but the application. So when we say liturgical medicine, what do we mean? Well, before that, what is non-liturgical medicine, right? What is the problem with medicine? And how many people, and including Dr. Roxanne with her plenary talk just now, are disillusioned with medicine? How many people, as patients, as providers, as ancillary staff, as observers, are looking at medicine going, what are you guys doing? What's wrong with you? I thought we were supposed to be caring about people, and it's well, it's not psychotherapy. Okay, but that's why we have organizations like OCAMPR that blur that distinction between medicine, psychology, and religion, right? We're either attending to people or we're not. If we're attending to people, then it might not be psychotherapy, but I'm a shoulder surgeon, and not everybody needs shoulder surgery. Okay, if you don't need an operation, am I already out the door? If you can get better with something that is not an operation, is that my responsibility? What if you can't get better, right? What if you have an unsolvable problem? What if you don't even really have a problem and you're just there because you're upset and it's manifesting itself as a shoulder problem? Is that something that I am responsible for? And I think this is what we're trying to at least recognize as the situation that we're in. We're in an era of non-liturgical medicine. It has become a business. It has become a thing that takes on personalities that are not about the caregiver, which is where, ostensibly at least it started, right? This is, somebody waking up one day being like, you know what, why are these people sick? What can we do about that? Let's make them better. Let's help them not to be sick anymore. And unfortunately, a lot of it's not about that anymore. The question is why, right? What have we identified as the problem, right? Because just like with shoulder surgery, we're trying to find the proper solution. If you don't have the right diagnosis, like, oh, you did a great shoulder replacement. Okay, the guy didn't have arthritis, right? You've solved the problem that didn't exist, right? And solving problems that don't exist isn't caring or treatment. So the workshop started, like the idea for the workshop started when I ran into Mena over the summer at a Coptic event. And, you know, as Coptic events always are, it's mostly social. Like that's why me and I are here, because like educational events, it's like, come on, we're gonna go sit and talk, and come on, let's play basketball. So yeah, we're at the basketball court. He's like, oh yeah, I'm going to OCAMPR. I'm like, oh yeah, that's cool. Like, you know, I wanted to do a workshop, but I haven't been able to, you know, coerce somebody to do one with me. He's like, yeah, I'll do one. Like, what do you want to talk about? And initially, the title of the workshop was supposed to be "Show Me the Glory." Have you guys seen Jerry Maguire? So I think if you remember that movie, it wasn't about the money, right? He wanted to be appreciated as a player, right? The money was just a proxy, right? When he was telling his agent, like, you got to get me more money, you got to show me the money, right? It wasn't as egotistical and money hungry as it sounded, right? There was a fundamental underlying need for him to be appreciated that in that business was recognized by money. And in our conversation, Mena and I, he was like introducing me to somebody. He's like, oh, Mena, he's a great guy, and he's an orthopedic surgeon, but he's not one of those guys that's like all about it. And I'm like, okay, like a lot of pressure here. And he's like, oh, he's really into like service and stuff like that. And the person he was introducing me to goes, oh, so what do you do, like, you know, clinically that's like a service? I'm like, actually nothing. And I was like, dude, you embarrassed me. And he's like, why? And I was like, you set me up because you tried to make this thing that we are either in it for the money or we're doing it like for free, and that's when it's really service. And I told him, I was like, I don't think that our clinical practice is a place where, number one, we can just sort of divorce ourselves from the bottom line. Like, if it's not a profitable practice, if like you don't control your overhead, if you don't show up and see enough patients, right? If you don't do a good job, right? If you're like, oh, but I really care about people, and like you don't know how to do the surgery, like there's some like really important practical elements, right? Those things are necessary but not sufficient. And in that clinical practice, you still have the question of, are you showing up for yourself? And just like with the Jerry Maguire story, it wasn't about money, it was about appreciation. In a service-oriented, like let's say you go to a mission trip, right? And I was talking to Dr. Constantine, and I'm hoping next year he presents a workshop. So shameless plug, next year's conference is going to be awesome. It's about hospitality, sacred hospitality, and we'll talk about that. But I was telling him how, you know, caring for the stranger, right? Like that's an aspect of hospitality. And we have a beautiful icon in the room up there when we were having our board meeting, the hospitality of Abraham. And the inscription was in Greek, philoxenia, right? The love of the stranger, xeno, like my big fat Greek wedding. Xeno, that's me. So hopefully next year he shares with us about all the mission trips that he's done and all of the great work that he's done around the world helping people. But we have to recognize, take a step back for a second. You're doing it for free. You're giving up your time. You are taking a skill that you have developed over the course of years. What is the operative word there? And all of those things that I just said. You, right? It's still about you, right? So someone that's saying, show me the money, right, is saying, I have a need to be attended to. And it's not as egotistical as it sounds. Someone else is saying, I have done all of these nice things. What are they saying? Show me the glory, right? Yo, check me out. The kingdom of heaven. Look at the kingdom of heaven standing in front of you, and it's not standing in front of you, it's on the cross, right? So this paradox, right, and that's what we've heard a million times, people quoting Father Hopko, right? Orthodoxy is paradoxy, right? You're talking about money, and it's actually about grace. You're talking about glory, and it's actually about ego. And that's the problem, right? Where it's so hard to track, right, what our motivations are. We show up, and it's well-intentioned, and I'm going to take care of people, and I'm like just sick of them. I'm sitting there, and like, complaining and whatever. And I'm like, I don't want to be here anymore, right? And it's their fault, and like these people are so difficult. And we have to recognize there's a mirror. Their pathology is exposing our pathology. I was on a couple podcasts recently. And I was very worried that I was oversharing, and I was like, who's listening to this? Like, I can't. But I think if we are self-aware, right, and we realize that, okay, we have some sort of insecurities, related to our upbringing, the patient is sometimes going to nudge on those things. And if they remind us of someone or something that we grew up with that made us uncomfortable for whatever reason, we're less likely to be able to attend to that patient. And it's easy, right? Very easy to say, okay, I'm just going to take care of myself, right? And we wall ourselves off, and it's about efficiency, and it's about outcomes, and it's about what my job is, right? And we define and we localize our job into this tiny little thing. So my question for you guys is, and maybe it's up to you guys if you want to do a discussion in a big group. Sometimes people are more comfortable discussing amongst ourselves. I'll leave it to your preference. If we get a lot of participation and people are raising their hands, then we'll do it as a group. If we find ourselves shy, then I'll say, talk to your partners and we'll come back together. But that question of, in your clinical practice and what you do, and it doesn't matter if it's, pastoral care or psychotherapy or medicine or anesthesia or chaplaincy, whatever it is that you do, are you able to step back and say, I get tired, I get sick of doing my job, I compartmentalize it, and to convince myself that I'm a good person, I say, I'm not doing this for the money. Look how much I sacrifice for these people. And Dr. Constantine's an anesthesiologist, so he has to deal with orthopedic surgeons. We're his patients. Like, the real patients are easy. It's the orthopedic surgeons that need to be attended to. Yes, doctor, I understand. No, you're so important, and we care so much about you. And the turnover time is not what we wanted it to be, but, that doesn't mean that I don't care about you, doctor, right? So, we're so caring, right, towards these people, right, and we frame it for ourselves that we're doing God's work. But the question I want you guys to discuss is, does that become itself, right, an ego gratification? And if so, how do we identify that? Like, what are we able to do to step back from ourselves where we seem to be doing something that's so giving and so caring and so attentive to the person that's in front of us, but it's really just back to being about us? So if you guys want to share now, go ahead. If not, please. Yes. Yeah, so let's, John, what do you want me to do? Here? Awesome. Can we pass that around? Yeah. Awesome. Let's do that. So that way people feel comfortable, and we're just talking to each other, just us mics, no recording.
Nothing happening here at all.
Right.
So it makes me think of early general medicine with a focus on a lot of end-of-life care. And I thought that I was just going to be this great, helpful, wonderful clinician when I saw clearly that, wow, we are ready for goals of care conversation here. So let's get all the people together. I'm going to help coordinate this. We're going to go in and hope that essentially, you know, I wasn't saying it in this way in my mind, but in retrospect, like, hope I can convince these people that it is time to focus on comfort. And in many cases, I do genuinely think that would be like the best trajectory for those patients and those families. And yet, what I've learned from a wonderful palliative care physician who taught me so much is we are never going to be successful if we go into these conversations with our own agenda already predetermined. And so he taught me, you know, as I'm walking into that room or into those settings and those conversations, like, gel in, as we say at our hospital, gel in and gel out with your hand sanitizer. But as you're gelling in, take some deep breaths, say a prayer, and say, not my will, be done here. And that really helped me in all of these perspectives in these situations where I think I know what's best, but I've only known this person for like a day or two. So, and I'm not God, so chances are good I really don't know what's best.
Yeah, yeah. I managed to do that without even saying anything. This is in Dr. Mamalakis' class at Holy Cross. He does this asceticism of listening class, and the first time you sit with someone, you're not asking questions, you're not saying anything, you're just reflecting back. You're just supposed to say like one word or, you know, repeat back what they, you know, said. And I found that I was able to be judgmental and coercive just by repeating back what I thought was important, right? Like it wasn't even like on that like end of the spectrum of like, let me tell you what to do. This is what you have to do. It wasn't even like well, what about this? Like these like leading coercive questions. I literally was just repeating back words, and you watch the video, and that's what he has you do. Like you sit with someone and you watch it, and I was literally sitting there going, how did you manage to do that, right? And until you recognize that, until you step back from yourself and see yourself with that judgment, you're not able to repent and say, oh, okay, I guess I need to actually pay attention to this person. Fine. What other examples? Yes, if we can pass the microphone to Sarah.
This is a really interesting conversation. I think part of it for me, it makes me think about what you talk about, ego and service and how we frame our service. It relates to the concept of calling too, and how we see our work. Is it a calling? And how do we frame that? And just to share, so I'm a chaplain. I've been a chaplain for 20 years. In my first hospice position, I've almost always been the only chaplain where I am, working with medical clinicians. And, you know, chaplains tend to be on sort of the low end of the totem pole. We're often not included in family meetings, you know, these kinds of things. And also, there is a sense, and there was explicitly for me in my first hospice position, where I was expected to be on call 24/7.
Wow.
Like, for free. Because
I'm the chaplain, so it's like my calling, as opposed to a nurse who has gone to school and this is their job, which of course we know a lot of nurses, this is their calling, and physicians and social workers too. And it was really hard for me because part of me was like, yes, it is my calling and I will do this self-sacrificially and that's fine. But I remember I wanted to go away for 2 days, just a vacation or something. And they were like, well, who are we going to call if you're not here? And I was like, so I ended up having to call my Lutheran minister friend and offer to have her be on call when I was gone for 2 days. Now, would anyone ask their nurse friend to be on call for free for a hospice? No, but my role was asked to do that. And so part of me, again, was sort of proud of the depth of my calling, but part of me was also incredibly offended that that was happening, but also felt very powerless to change it because of our certain cultures around healing and calling and job versus vocation. And it's something I still struggle with. I mean, I'm still the only chaplain in the entire DOM at MGH. I think of myself as a medical clinician, but in many ways I'm not, because I come from this different perspective. So I struggle with that in both ways.
Right. And you end up doing the same thing, right? But the motivation behind it is what gives it meaning. Dr. C.
I'm in a very technical field, okay? And, Dr. Mena and you're an orthopedic surgeon too? Okay, orthopedic surgeon. He'd have a hard time killing you. I have seen it once where in back surgery they hit a real deep vein and it was hell. But we can do that. So I have to be very focused. What I notice is a certain division, this compartmentalization that we decry as being bad. One of the things I've tried to do in the last 30 years in the hospital is whenever I find out there's someone from the community or anyone that I might know, I go and visit them in their room. And my demeanor, my whole feeling is totally different when I go to do that. I'm there just as a visitor, and I don't have to worry at all about their care, because it's just is that a bad thing, that compartmentalization? It's kind of hard to do sometimes. It's like a pilot. When you're piloting an airplane, I don't think you need to worry about the emotional state of the passengers as much. You've got to get them down to the ground. I'm just saying this is what happens to us. So. I don't know if I need to try to bridge that. Certainly when you're talking to them preoperatively or postoperatively, there's a lot of things that I've learned where you can relieve their anxiety. So I guess that's when it happens. But there has to be, at least I have to find a cold detachment is absolutely essential in my job.
Interesting. So let's walk through that, right? Because what I'm, I guess, presenting as a question is, and I was talking to Father Andrew about this yesterday, how so many things that we think are value judgments, good and bad, are, in the Greek would be adiaphoron, right? These things are morally neutral. They're ethically neutral. They're raw materials that could go either way. Now, I think what you're saying is that your detachment is protective for you and beneficial to the patient, and that to a certain extent, if you were too connected, it would could potentially be a problem. And I think that it's an interesting point to bring up in a conference when we're talking about personhood and like wholeness and like attending to the whole person. And I can tell you that I have to detach, right? You can't cut somebody that you are seeing as a person, right? So for that period of time, it has to be this objectivization, right? It has to be, okay, like I'm not cutting grandma, I'm cutting this shoulder, and grandma's gonna see me later, and I saw her before, but like right now, like I'm attending to this task, which one of these podcasts I refer to as video games, which is like, supporting your idea that like there has to be this sort of like no, like we're doing a task, right? We're not attending to a person. So is that necessarily bad? And going back to Sarah's thing, it's all about why, right? If they say you're going to be on call all the time, and you say, well, I guess the patients need it, and I'm able to do it. Like, I happen to live across the street from the hospital, and it's really not that big of a deal, right? Like, the patients that have my cell phone, right? And they text me and they're like, hey, what's wrong? And I'm like, oh yeah, like I don't think that I need to draw that boundary, right? If they take advantage of it, which they never do, then yeah, I can say like, well, listen, this is a little bit too much, right? But for them to text me and for us to, okay, that's not a big deal, right? But if the reason that I do it, right, is because I have this dependency and I'm unhappy and like the job fills a void, and if I'm not at work, then I'm nowhere, and like I've got kids that never see me. Whoa, hold on a second. You just did the same thing 2 different ways, right? So that motivation behind it. So I do think that if your detachment is helping you to connect better and do a better job, then sure.
Well, I guess in my field particularly, during that period of responsibility, you need to have a cold eye. But before, I always made a point of sitting down with the patients. I always ask them what they do, a little bit about their life. I actually enjoy doing that. I also had a pain practice for 20 years, which was totally different.
Oh,
and there I enjoyed being in with the patients. And I'll tell you another thing.
That's therapy.
And that was there. Oh, believe me, and the little old ladies loved me. I'm good. I had a Greek yaya, so I'm good with the little old ladies. But
did they bring you food?
You'd be surprised what I got. I got all kind of things.
Yeah.
Cotton socks from the factory where they worked and other kind of things. But anyway, the point being, one other thing I made a point of, and this didn't happen very often, a death in the OR is very rare, but it happens. And I always made a point of, the surgeon now needs to go talk to the family, but I always made a point of going with him and sitting with the family and making myself totally exposed. Please ask me, tell me, I'll tell you. And I thought that was a duty I needed to do. Yeah. And I didn't feel complete unless we did that.
Yep.
Thank God. It was very, very rare, but it happened. Anyway, I don't want to.
So we're halfway through our workshop. So we're going to discuss again at the end, but I do want us to transition to the conversation that we've already started, which is, okay, we've identified the problem. How do we transition to doing it? So if it's not what we do, right, and it's actually how we do it, and we've identified that liturgical medicine is not the norm, and it's countercultural to actually attend to people, and what it means to attend to people is not obvious, right? You can attend to people and look like you're detached, right? You can be, oh, I'm so into it. Oh, I care so much. I'm such a good doctor, and it's still all about you, right? And I tell people that if Christ did your job, it wouldn't be this, I'm so good at this. He would just be good at it, right? Like, he would do all of our jobs better than we're doing them. He would have studied hard. He would have shown up. He would have been on time. I'm not usually on time. He would have done the job, right, without ever being part of the equation, right? You wouldn't even notice Christ doing this job. So what we've been discussing, right, without pointing it out before, is how do we become more like Christ, right? How do we become healers after that model of Christ? So Mena's going to come up and share with us how sacramental clinical practice is how we can sort of drift in that direction, at least.
What a great discussion so far. This has been awesome. And I think one way to further confuse the audience between Mena and I, like Mena dressed up like a psychiatrist with the elbow patches. So just who's who. And I'm looking casual like a surgeon. Oh, I'm on the way to go, cut people. But just for clarification, so I'm a psychiatrist by my day job, and one of the ways that I think we actually fit really well here, besides the fact that we're both Mena and we do the same things and we think very similarly, and that Mena taught me for years when I was a kid, just dating him a little bit just to make sure like he's the old one. You're the pretty one. That's right. That's is that we've really been thinking about this concept, like we were talking about preparing for this workshop, whether it was the summer, but in some ways we've been preparing for this workshop like our whole life. No pressure, right? But I know it doesn't show sometimes, but it really does. Because for me, so this is anyone know what this is to hear this picture? This is a Googleable Zoom background. Okay. This is a shrink office. If you were to like Google, psychiatrist office, this is what you'd find. So this is my actual Zoom background when I see patients, because I figured the easiest thing is just to steal something off the internet. And my question for us, in the context of what we just talked about, all the things here that we said of what's not there, can you spot the sacrament in this picture? Like where's Waldo kind of thing, right? Like where's the sacred here? Where's the liturgy happening in this picture? Is it the plant? Is it the chair? Is it like the psychiatry ambiance of a picture, right? One of the things I was really struck by yesterday, one of the speakers who were saying, you know how we can go, like our liturgical practice is mobile, right? Like if you're starting a new church somewhere, you're starting a new parish, you can set up an altar, right? Like we don't have this idea that some other folks have, which is unless you have sort of this kind of beautiful, incredible church, you can't pray a liturgy, right? That's not what we believe. We believe that you could be somewhere and you can set up an altar, right? Can you set up an altar in a psychiatry office? Can you set up an altar in the OR? Is that something that we can set up? Let me put it to a different way. Let's say we're really strapped for space and we're going to go somewhere, and you know what? We got to celebrate something sacramental and spiritual and beautiful. We got to use this funny looking room with weird, lighting and stuff. Let's say before we set it up, we're going to go in there, we can have coffee. We can hang coffee, but very New York. I'm from New York City. I should have said that in the beginning. Maybe I'm a psychiatrist from New York City. We're going to go in there, we're going to have coffee, we'll have some bagels, we'll chill, we'll hang out, we'll talk about life. And we're very casual, very chill. Like it's just, If we set up an altar in this little space, maybe by the couch, and we face east, and we have an icon, is that going to change the way we behave in that space, in that room? We'd hope so, right? Because we have, right? Hopefully, right? I didn't see any bagels or coffee last night in the service, right? By nature, like we as Orthodox, if we're venerating an icon, if we're going into a church space, there's an inherent reverence that we've got. Oh, this is a space, God is here. God is doing something. We're quiet, and we're focused, and we're attentive, and we're listening, and we're focusing, and we're praying. My belief, and I think this is something that I've been learning a lot from Dr. Mamlakis and everyone that's been teaching over the past couple days, is that we are meant to practice sacramental, liturgical psychiatry, orthopedic surgery, chaplaincy, pediatrics, etc., etc., etc. I try to remind this to myself. I have a little sign in my office, where you have like your name, so that you remember what your name is. Mine says, Mena, whatever, shrink, and it says sacramental psychiatrist. People sometimes ask me, is like, oh, where'd you go to school for that? Like, I went to Sacramento school, obviously, bro. People ask me, like, oh, what's psychiatry school like? I'm like, oh, there's Sacramento psychiatry school. But I believe that naturally, like Mena was saying to us in the beginning, the system sets us up to not only like not have sacramental or liturgical practice, but dehumanize people and to think of just like, oh, people are numbers, people are a billing code, you are a 99. Oh man, look at you, you're looking like a good 9921 ICD code, right? It's a joke for just ICD people. So people are not an ICD code. People are not a billing code. People are not dehumanized. So the system sets us like this, but then we've got this weekend that says to us, hold on a second, you can have a sacramental practice. Whatever your thing is, whatever your specialty is. Let's talk about maybe how we do that. Because here's what sometimes I feel, I'll confess to you, right? Like I said, I'm a psychiatrist. Sometimes there are days where I approach my day like I'm about to go into a liturgical experience. So if I'm about to go into a patient's office or a patient's room, let's say in the hospital, it's maybe a particular week where I feel like, or I'm attentive to where God is, and I prayed beforehand, and I say, all right, Lord, this is a sacred space. And sometimes I'd approach it with some veneration, like physically, so I can actually, because as we heard yesterday in that beautiful memory talk, one of the ways that God has to remind our fragile, feeble mind is by physical things, maybe bending down and saying, wow, this is a sacred space. I'm about to go into this room. This is not a room, this is an altar. There's a beautiful quote that I didn't put in the presentation, but always moves me from St. John Chrysostom, as he says, you can offer up liturgy at any hour. He was talking specifically about the poor, right? The altar of the poor is a place where you can offer up liturgy at any hour. Do we believe that there's also an altar in the sick? An altar that you can offer up liturgy at any hour. So far this sounds abstract, Orthodox thinking, but it's not, right? It's real. Because for me, I can see the difference. I can see there are days where I do that, and I have a mindset going in is like, okay, here is the sacred encounter. Here is the liturgy. I'm actually quieter when I do that. I'm less, oh, what are you here for, brother? What are you going to do for you too? And I go in, and I'm attentive, and I can see the person. And my goal is then communion for the person, for me. And then there are days where I feel like this. I feel this verse. I feel, surely the Lord is in this place, and I didn't know it. Have you ever experienced this? Like, I had this tough experience in one conference where there was a really good buffet. And then afterwards, people were like, yo, did you catch the mozzarella sticks? I was like, I missed the mozzarella sticks. This is absurd. Mozzarella sticks are cool for me. I'm a big fan. But like, if you miss a liturgical moment, like imagine if we go to celebrate on Sunday morning and I'm like, yo, that was awesome. It was very spiritual. And like, the bread tasted a little like, a little less, was it like for me? And people were like, dude, it wasn't, what are you talking about? Did you catch the fact that this was Jesus? I'm like, oh, true. I thought it was just really cool bread and really cool wine. That would be tragic. Wouldn't that be tragic? If we enter into a sacramental moment and miss the sacrament? If we enter into a liturgical moment and miss the liturgy? This is an icon. This is the best one I can find. I don't know if it's super HD. Can you guys tell what this icon is sort of representing? What sacrament, right? The unction of the sick. I have a question for you. Does this work? Does this sacrament? And it's a funny question that I've sort of been asked one time. Does the sacrament of the unction of the sick work? Is it effective? Is it hand raised for yes, it works? Hand raised for I don't know. Hand raised for this is a trick question. You're not about to get me on video with a trick question. Nice try, Mena number 2, but not today. Not today.
We've been in a Sunday school class.
Yeah, this is a trap. You are now excommunicated. That's right. The answer is love, right? Jesus, right? The Eucharist. The question is, so background, even before I answer this little potentially trick question. So one of the most powerful things I've ever experienced in my hospital is when an Orthodox priest came into my hospital and anointed the sick with the unction of the sick in the psychiatric unit. It's like, oh. These guys can come in here too. I was talking with somebody yesterday, I don't know if he's here, but an infectious disease guy, and we were talking about leprosy. You guys remember leprosy from the Bible? Apparently it's still around. This was news to me. That there's leprosy colonies that exist. There are places in the world where if you have leprosy, you've suffered the consequences, and that's it, you live in isolation. There was something about Jesus speaking to a leper, and he didn't just say from a distance, like over a microphone, you're good, over there, leper guy, oh, A-okay. What did Jesus do to lepers? He touched them. He touched them. One of the most striking things about a sacrament of the unction of the sick is that it doesn't, my understanding, and there are priests here who can correct me, I don't know about all this stuff. Can you do that like via Zoom? Maybe you can these days. I feel like sometimes you gotta do what you gotta do. But oftentimes when you can, it's done in person and it's with a touch, because it's not just the anointing, and it's not just the inviting the person into repentance, and it's not just the inviting the person to the presence of Christ, who is being connected to here in the sickness. Like Christ is, right? Like as the speaker said yesterday, without the incarnation, grief is intolerable. Without the incarnation, depression is intolerable in a lot of ways. Without the incarnation, despondency is intolerable. Without the incarnation, all these things. But imagine the flip side, the incarnation is here. And Jesus can come into a person who is in a psychiatric unit after attempting suicide And Jesus say, no, that there were, like, I'm here. I'm here. When a priest touches the person and anoints them and says, you are not just in the presence of Christ in this sacrament, but we as a body of Christ, you're still part of the body. You're not a leper in mental illness. You're not someone that is cut off from the body because you're experiencing this suicidal experience or a psychotic experience or whatever the case may be. And that's why I think this sacrament points us to the real goal. Like, what's the goal of mental health treatment? I think Dr. Mamalakis put it in like the most beautiful way possible. I was fangirling over him. They said, oh my God, that's so true. Right? Because even at best, what I experience in the mental health world is, at worst, I was talking with a psychologist earlier in the break, the worst part of it, or at its worst, we somehow, currently, the state of the country, we are way over-prescribing. We prescribe more meds than we ever have. And we are also way under-treating. How is that possible? How have we managed to have an Ativan shortage? Like, that really happened in hospitals. We ain't got no more benzos. Everybody's anxious. Xanax, Ativan. We don't have any more. Okay, well, I don't know what to do now. That's it. Yeah, we're done. We're done. That's all we got. We managed to overprescribe and undertreat because the broken version of mental health is there's a medicine for every symptom. What's that? You're tired? Medicine. You have too much energy? Medicine. Too much energy. Slow down. Medicine. Right? And again, the caveat here, I prescribe medication, right? I think medication is, as Father Thomas Hopko said, like, it can be a way that if you're prescribing it in a way the same way that you would be giving a blessing, right? You would be praying beforehand, and this can be a vehicle for communion for the person. Just totally different from the way sometimes we prescribe medicine. Here's 10 medications for everything. No. If I understand, right, the real goal of mental health, I understand my liturgical role, as God has given me a priestly component in my baptism, my chrismation, I sanctify medication. I sanctify the therapy space, and I don't give it lightly. A word I use is not used lightly. A medicine I give is not given lightly, because it's a sacred thing in the hand of a sacred or a sanctifying Holy Spirit who can give, and then it's not about changing a neurochemical process. That's not all we are. Because the real goal of mental health treatment is communion. The real goal is really communion. And I think of this, I was trying to challenge myself as a patient too. When I go into my own therapy, or when I go to my primary doc, do I go into it as like my goal here as a patient is communion? If I do, then there's a set of ways that I prepare myself, and we're going to talk about that maybe in discussion, but there's a way that I approach the sacred and I prepare myself and think through, because I'm now coming to receive communion. I'm coming with my open heart and mind and soul, and let's go, Lord. I'm here to meet you. I'm here for communion. But it's the primary care office. No, it's not. But it's just a Zoom therapy with my awesome therapist, Father Charles. No, it's not. It's more than that. It's communion. And then for me, it's the same thing. If my goal is communion, and like, again, let's really like dig deep into this. This is not a metaphor. I'm not saying to you this is like a really cool way that you can like spiritualize your practice. This is reality. The reality of OCAMPR is that we are here to be reminded of our sacramental and liturgical call for every individual practice. And if an Orthodox person is practicing this way, because let's be honest with each other, right? Like what was presented yesterday about Orthodox mental health. I've seen a bunch of Orthodox people who are Orthodox mental health practitioners. Some who understand and treat this way, and some who don't. And we have a choice. As Orthodox people, we're all Orthodox, but we don't necessarily have to practice in a sacramental way. Sometimes we miss it. Sometimes the Lord is here and we missed it. Like Father Alexander Schmemann said, the only real fall of man is his non-Eucharistic life in a non-Eucharistic world. I'm not about this life. I'm not about this non-Eucharistic life. I'm not here for that. I believe the only reason I'm a psychiatrist is to practice sacramental psychiatry. I believe the only reason that not the only reason, there are tons of bad reasons, but the highest reason for my salvation, for your salvation, is to be a sacramental chaplain, a sacramental pediatrician, a sacramental whatever it is that we are, whether you put it on your business card or not. I choose to not live in a reality where I will practice non-Eucharistic anything. I'm not here for it. And just to even be more transparent with you, the world can't live without this anymore. The mental health world, the treatment that we give is so lacking. And what's lacking is not another really cool, like, spiritual buzzword, or like a really nice way that you can self-care. Some other new, like, Oprah thing. It's not. Like, Oprah's cool. No disrespect to Oprah, if she's listening. I mean, she's not. Okay, sure. I just want to, can't come for me. Don't come for me, Oprah. I can't handle the fan club coming at me, okay? But
If Sylvia and our moms watch this, that's it.
Hi, Mom. But what the world is, like, desperately needing now is a Eucharistic practice. And we'll go with this, and then we'll have maybe a few minutes for discussion, is what Father Alexander said. Centuries of secularism have failed to transform eating into something strictly utilitarian. Food is still treated with reverence. To eat is still something more than to maintain bodily functions. People may not understand what the something more is, but they nonetheless desire to celebrate it. They're still hungry and thirsty for sacramental life. This could not be more true than it is in the health professions. People don't always know what it is, but they're like, there's something more. That something is what God has been preparing all of us for all our life, is to bring this sacramental life and to understand what is my priestly calling, to sanctify the moment that I'm in, to sanctify the office that I'm in, the OR, the inpatient, the outpatient setting, in a real way. In a real way, a sign of the cross, a reverence, whatever physical gesture, whatever mental mindset. And then that carries over into my conversation. And there's a real spiritual space where God does whatever God does. I have no idea, again, full disclosure, I have no idea how God transforms bread and wine into body and blood. Anybody else know how God does that? Like the mechanism? Right? We're always open to new. Right? But I don't understand it, but the mystery remains true. And I still hold to it every single time I go. I'm like, that happened. That happened. And I'm here for real Eucharist. I'm not here for superficial, awesome bread and like really sweet wine. Let's not settle for that in our own clinical practice. And let's ask ourselves, okay, let's say practically now, discussion time. So today's Saturday. We've got a liturgy tomorrow, right? There's a liturgy on Monday, right? We go back to work. How do we prepare for liturgy? Because, spoiler alert, right? When we're not prepared, we miss it. We get that slide. So that's participation time. You tell me, if it is a real liturgy, how do we prepare for it?
Can I ask you a question?
Yeah.
So, I already confessed to Randa that around 6 o'clock yesterday, we're like, so what do you want to do tomorrow? And like, we should have slides, right? So I probably should know what the rest of the slide is. But do you have more on this slide? Are there bullet points? Or is this is it? So I just want you guys to realize, like, we started with what we're not going to do, which is like, I don't know, liturgical medicine. What do you guys think, right? And we've just talked for, we started a few minutes late, so maybe 50 minutes or so, 45 minutes or so. And I think we're back where we started, right? We framed the problem, like, it's not really exactly what you're inclined to do and what you're incentivized to do. And it's like, wow, like Christ, like this Orthodox tradition of like inviting Christ. It's like, we've heard that a million times. Like, oh, we got sacraments, right? And now we're ending up where we started, which is, well, I don't know. Like, what do you guys think? And we have 8 minutes, right? And the people that are watching this, right, like Oprah, not, are also invited to reflect on that same question that we're not going to answer, right? That's the eschatological perspective on this, that maybe eventually it'll be answered in a different place, right? In a different type of time. But for now, I do think that in addition to discussing it, I was like, oh, time out. Did you put bullet points up there? Because it's much more profound if you don't, right? Right? If it's not the answering of the question, but the asking of the question that matters. And yes, we are completely unprepared for this. We're like, oh, dude, we signed up for this workshop. We gotta do something, right? Right? I think I told Sarah's like, you did what? Like, yeah, it'll be fine. It'll be fine. Like, people will talk. They'll contribute. So, asking this question, I think, is the unction of the sick question. Like, does it work? Like, I don't know. It's a good question. So, let's talk about some practical things in the next 7 minutes, and then beyond that, keep asking that question, right? Ask it Sunday night. Ask it Monday morning. Ask it after work on Monday. Was I prepared for liturgy today? And the answer is probably not. I was tired. Go camper. I was flying and tired. I was already out of gas by the time I was already like spiritually burnt out, and I didn't really listen to anybody today. Okay, like, how do I do it better tomorrow, right? Like that confession, repentance cycle. So, I like that you didn't do anything. That's awesome. Yes, we have the microphone.
Thanks so much for this. Just reflecting, I think one thing I keep thinking about is, we all need in the body of Christ, one is the hand, the toe, the foot, the eye, right? And when are we in systems, and when do we ourselves get into this place of competition and comparison? Well, I'm billing a 90791. You're billing 90772, right? You're billing 99211. Sarah's not getting to build anything from grant funding. Which hand, toe, foot, or eye is more or less important? And even if our system sometimes is not liturgical and not sacramental and not viewing it that way, how can we ourselves view it that way? And then as we think about how do we be fully integrated and alive beings, Christ as the healer is healing me just as much as the shoulder I'm repairing, this Ativan I'm hopefully not just prescribing, right, etc., because we are just as much impacted by this encounter. And it's not all about us, but I think we have to keep asking these questions. How am I preparing for the liturgy of the workday, and how am I being healed in this? But I think so often we can sort of compare of like, oh, well, Dr. C, he's just detached. He's not connecting with his patients. He's just focused and dialed in on this. Is that really sacramental medicine? But he's supposed to be doing that. Is he fully integrated as he's coming to work? I have prepared in my whole self, and I am choosing intentionally to be detached so that I can work at what I, work with excellence, right? To evidence Christ in my work. There's a moment where I have to be detached. I'm a primary care psychologist. I don't get the luxury of a full hour with each of my patients. I have to have brief 20-minute consults and tell the physician. There's a moment where it's, this person is talking about suicidal ideation. I have to decide, where are we going with this? Yeah. And so in that moment, I'm not just like, oh, this is grandma on the table, right? Oh, this is grandma in your SI. It's like, I pray in that moment for clarity. God, make this clear. I don't want to have to hospitalize this person because that's going to delay me. That's going to be a whole thing. I have to deliver the right, all of it, right? This person is not going to be on board with this. This is going to be a problem. But I also, in that moment, I don't want the person to be experiencing this pain. But if you're experiencing the pain, I actually want to know about it. Right. So in those moments, I'm like, Jesus, bring clarity, please. And there's that moment of where I don't often experience detachment, probably in some ways that maybe surgeons and others do. I think we all have moments where we need to be detached for the right reason. So I think it kind of goes back to sort of the why and the how, and how we're bringing our full self to that, and how we're continuing to view each of the other members of our team before and after in a humanizing way. even if we need to be a bit more detached or compartmentalized in the work that we're doing to do it well. Yeah, anyway, these are just the thoughts running around in my head as you guys have been talking, so thank you so much.
There's a comment. I just wanted to share two quick thoughts with what you said, Casey, because there was a study once, because a pitfall that often comes with this idea is that this is going to take a ton more time to do. And like, ain't nobody got no time for nothing, right? One time there was a study where they said, tracking a doctor's time in the room and the perception from the patient's standpoint, right? If the body language and the demeanor is that I'm here and I'm not in a rush, it was universal across the board. Every single patient said, oh, the doctor was here for 20 minutes. It was 4. So it doesn't take more time, but it takes more presence, right? So that's the one thing. And the second, I remember this quote, some paraphrase from St. Basil, talking about how the Eucharist is this ultimate understanding for us of equality and justice. And like for us, if we understand as a team, it's like, yes, every single person that's coming to receive, no matter how many letters are after their name, or how few, or how much billing reimbursement they get or they don't, you come to the same table and you get the same precious body and blood. So those two things just kind of help me sort of put that in perspective.
Oh, I'm sorry to end. It's not that profound, but I'm a family doctor, so in some of that same primary care time stretch, and there's that preparation, like you prepare for liturgy by doing your pre-communion prayers. You know, you pray in the morning, you get ready for your day. There's also the prayer that happens in that moment, and it's tied to a humility. Like, I'm a professor of family medicine, right? I'm supposed to know everything. I don't. I don't know, and I can't do this without Christ. And it's a moment to walk in and ask for guidance. Like, just be, use the tools, of course, that God has given you and your education has given you. But in that moment, you have to be guided. And that has, for me, been an amazing experience for 40 years, that when I need Christ, if I ask for him to be there, I get that guidance. And it's a kind of detachment. Like, it's a detachment in the sense that, I'm still typing in the electronic medical record and I'm still trying to listen and be there. And I'm sort of multitasking in that way, but also asking for help.
I have an unction story. Can I tell? For 2 seconds. When I was a medical student at Duke, tertiary care top thing, there was a young Orthodox man in his 20s in ICU, intubated, on pressors, the max thing, going downhill. So his mother says, can I ask the priest to come? So I asked the attending there, can the priest come? They gave it a scoff. So the priest came, did unction for this kid. He rallied. True. A week later, approximately, he started going down again. She did the same thing. They kind of scoffed again. The priest came, gave this boy unction. He rallied. And I forget, was it a couple of days or a week later, the kid started going down. The doctor says, call the priest. Get that guy. True story. True story. Now, but it doesn't end there. It doesn't end there. So this time, he really didn't rally. So the mother asked the priest to give him communion. Priest says, I cannot do that. He's unconscious. He's intubated. We can't do that. She got so angry, she went to an Episcopalian church, got some communion, and she did it herself. And then I learned this from the priest later. I wasn't there for this part. And then she left the Orthodox Church for like 8 years. But the story doesn't end. This is up in Durham, North Carolina. So now I'm down in Atlanta. And through some other ministry thing I was involved with, this lady called me. And she said, I now know. And I said, I realized my arrogance and my ignorance, why he couldn't have communion. He died, actually, the boy, at that time later. And she said, and I have come back to the church, and I understand why Father, I won't say his name, couldn't give the communion. And I said, well, please call him and reconcile, because he told me about it later, and it weighed heavily on all of us. It was a very sad event. So it had that whole circle. Isn't that wild? Across several states, this thing, and over several years, the circle closed. So it was just...
That's a great way to end. Thank you.
Take us home. Yes, all right. Well, I just want to thank you both for a phenomenal presentation, but it's...
and not even a presentation, but a conversation and thought-provoking. And I know all of us are going to be going forth from here with some pearls of wisdom. And so we're thankful too. Thanks. Lunchtime.
Thank you all.